Now we look at the next type of clubfoot deformity, and this is what is known as a talus valgus. So we look at the talus valgus. So for the talus valgus, um, just try to define the terminologies and everything. So talus, of course, you know that what is congenital deformity where the foot is what shifted in one way or the other. So the valgus, to be specific, where is the valgus? Here is bent and the person is walking on the side of the foot. Okay. So it's often known as what? Talipes calcaneovalgus. It's a common congenital foot deformity. The foot is pointing outward and upward. So it's usually flexible and often resolves with little physiotherapy, stretch, and the person comes back to normal walking. Okay. So it's mild, right? So the type of positional talipes where the baby's foot turns upward and outward. So it's most often due to what? In the stomach, the baby was not positioned well. Limited space in the womb. Maybe there was multiple pregnancy, twins. So the womb couldn't actually contain them that much. Breech presentation. Amniotic fluid was little, you know. Restricted fetal movement leading to abnormal foot position. So epidemiology is common, right? But is less frequent than the most common, which is what? Talipes equinovarus, which we always say is what? The classic. Okay. So that's what we got. Then clinical features is what? The foot is angled upward and outward. The sole is facing laterally. Flexibility is flexible. It's usually flexible. So if you do a lot of physiotherapy, a lot of stretching, or if you cast, it comes back to normal shape. Okay. So diagnosis is often dictated at birth, and you should always differentiate it from the Talipes equinovarus, which is usually rigid. Okay. Um, this Talipes valgus is usually, fine. Okay, and flexible. So I think this is what we have as regards. Uh, this is what we have as regards Talipes virus. Okay.